Hi everyone, hi, welcome to Monday Mindset. Can't wait to kick off. So we're talking about health anxiety tonight, and I've just had a notification to say that I've not got much battery. So I'll try and make it quick to fit everything in. If you are coming on live, then hi. If not and you're catching the replay, then please leave a comment and say hashtag replay, just so I know how many have seen it. So it'd be really good for you to put hashtag replay in there. So I'll try and get through it quickly before my battery dies. If not, I'll jump on the laptop and come back on. Hi Chris. So health anxiety. So what is health anxiety? It's having a hypersensitivity to sensations that we have in our bodies and having sort of like a fear of what these sensations could be. So we could build up a fear that these sensations in our bodies could mean really catastrophic things that we can feel really anxious about. And we can spiral into the fears of having these. There can be a lot of what ifs, what if worries that I always talk about. So this is something, usually it starts off with, well, what if this headache isn't just a headache? What if it's this, or what if it's that? And it could be that, or what if it's that? There's a lot of what ifs, a lot of predictions, and just a lot of worry spiraling out of control when it comes to health anxiety. And it's something a lot of people do really struggle with, especially more so during this pandemic, obviously. And also we tend to believe our feelings. So whenever we have a feeling, we tend to believe that we're having this feeling because something's wrong, something is bad is going to happen, it's more than we think it is, that type of thing, when in reality that we don't actually need to believe our feelings. This is something that we actually go into the 4-week program for overthinking that I'm doing right now. So it'd be good if you catch on the next one, when I do it next time. We don't actually have to believe our feelings, but we tend to believe them. Even when we are reassured by a doctor, or maybe we've got a heart monitor, or maybe we've got some equipment at home, or we Google things and things like that, sometimes we are reassured that we're okay, but that only lasts temporarily. So we might feel a bit better temporarily and then it'll come back. And the reason for that is because it's not actually a health issue, it's an anxiety issue. We have anxiety, and that's why it keeps coming up and keeps coming back for us. So also we tend to sort of feel, we kind of know it's irrational to think these thoughts, but we do them anyway, and we can't stop thinking about them, and we can't stop worrying about them, and that is very normal too. So it's not a case of just being able to be like, this is rational and, that's it. Like, we know it's irrational, but these thoughts keep coming. So health anxiety is something that I really did used to struggle with. And from my sort of experience, I've come across 2 types of people that have health anxiety. The first type of person, like me, those who constantly try and get reassured by someone, by a partner, by a family member, by Google, by a doctor, going to see a doctor or going to the hospital. So those are the people that really sort of try and get reassured all the time. Another type of person is those that still have anxiety, health anxiety, and still feel really on high alert and anxiously quite high on the scale, but they avoid doctors at all costs. They do not go and see them, they will not go to a hospital, they will not speak to them, they will not enter a doctor's surgery and things like that. They will just avoid it at all costs. So I am type number 1. Well, I was type number 1. So I used to, doctors and hospital was like my second home. I always used to try and get reassured. I hated having to do it. I hated ringing them, and I hated having to go in, but I needed it. I needed to be reassured. I would ask my husband all the time about all sorts of things. So I was type number 1. So a couple of things, I'll go through it quickly because my battery's about to run out, but a couple of things that you can do. So the person number 1, the things that you can do for that is to actually stop Googling. Make a conscious decision to stop Googling. So the thoughts that come up when you're like, oh, I just need to Google it, make a conscious decision not to do that. Even you can uninstall the app. That's something that I did. Don't go on it. So that's one tip. Just, you've got to start deciding that you're going to, batteries run out. You've got to decide that you're going to consciously not Google your symptoms. Another one is to trust your body. So think about the times when you had all sorts of sensations in your body. What came out of it? Were you fine after it? Start to trust your body and start to sort of say better instructions to it. So if you're saying constantly, like, you know, you're worrying about your symptoms or your sensations in your body, you could actually start to repeat the things that doctors have said. Things like, oh, my test results came back clear. I'm absolutely fine. You know, I spoke to this doctor and they said it could be this, and things like that. Constantly reassure yourself and constantly reassure your brain that it's not something that you need to be scared of, because that's a really sort of, our brain needs instruction from us to be able to determine whether we should be scared of something or whether we shouldn't be. It will always keep popping in, but that's something that you constantly need to do. You need to instruct your brain on what you want it to do. So with the person type 2 who avoids absolutely everything, avoidance fuels the anxiety. So if you avoid something because you're anxious, it actually fuels it and it keeps the anxiety cycle going. So if you actually try and face your fear, that's when it starts to decrease and get less intense, and you can start to push past the anxiety. I know that it's easier said than done, so if you are someone that really cannot do that alone, I would suggest going to a therapist, and they will help you set little goals and little steps to take to be able to face that fear of seeing a doctor. So you could book an appointment over the phone so that you didn't have to go into the doctor's surgery, you know, be around people, do it over the phone if that's easier for you. But definitely speak to a therapist if that's something that really, really scares you. Speak to a therapist and they will help you go through those steps to get to the other side of it. So definitely don't avoid it because it fuels the anxiety. So in my experience, when I did have health anxiety, especially a couple of years ago when I actually was in hospital for 2 weeks for heart complications, I won't go into what happened because I don't want to make anyone feel anxious, because, you know, that's what happens when you have health anxiety. But I was in there for 2 weeks to do with my heart. It was obviously a very stressful time for me. I was very, very, very anxious. And I was in there for 2 weeks and I was constantly on a heart monitor. I was constantly, I knew that cardiologists and doctors and nurses were constantly seeing my heart rate, my beats, how many beats I was having and things like that. So when it came to being discharged and, you know, I was on medication and they sent me home after 2 weeks, at that point I had to come off the heart monitor, obviously, but when I did come off it, I instantly felt very, very anxious because I no longer had that reassurance that I was being looked after, I was okay, my heart was being monitored and things like that. So I had to try and muddle my way through it myself. And so the steps that I've given you already, those are the steps that I took. So I was very, very anxious for a long time after the hospital stay that I had. I would constantly feel my heart all the time. So obviously, usually we are completely sort of unconscious to the fact that our heart is beating, but because of the experience I had, I could not feel it, if that makes sense. It was just always there. I could feel every beat, and it just really filled me with anxiety, and it was really hard to not think of it and not feel it. So it was a very difficult time for me, but when I put these steps into place, that's what really helped me. So what I would do is constantly repeat and tell my brain the instructions that I needed to tell it. So I would constantly reassure myself. I wouldn't get reassurance from anybody else. I reassured myself from what the cardiologist said, from what the doctors said, from all the tests that I'd had done, the scans that I had done. I would constantly reassure myself and my brain every single day that I am okay, I am healing, my heart is repairing, and things like that. I consciously made a decision to stop Googling. I stopped Googling symptoms that I had. I stopped looking at the heart condition that I was diagnosed with. I stopped doing all those things. I'm completely fine now, by the way. Like, it's totally healed itself. But obviously at the time it was very difficult for me. So I made a decision to stop doing that. I was checking my pulse all day, every day. I stopped doing it. But I know that a lot of people have like heart monitors at home and checking the pulse and things like that, and temperature. Like when you consciously decide and make a decision to stop checking, that really, really does help. And also what I used to do is I always used to ask my husband. I always used to say, Dave, I feel like this. Please tell me it's going to be all right. This is all of my symptoms, what do you think? Things like that. I consciously made an effort not to do that. I still had those urges, I still had those thoughts coming in and saying, I need to ask Dave, I just need to ask him. But I didn't ask him. I chose not to do that. They would still come, but I made the decision not to. I used to ask him to take my feel my pulse as well. I stopped asking him to do that for me as well. So it's all about making a conscious decision to stop the things that break the habit of being reassured. Start to try and reassure yourself, trust your body, because your body is amazing. It's designed to help you. It is designed to help you. It's designed to protect you, and it's not there trying to attack you, trying to make you feel unwell and things like that. Those stem from your thoughts, and if you try and change your thoughts and break the habit, that's when you start to become better with the health anxiety. So yeah, definitely do those steps, definitely. Something that really helped me was that I also found a mindset coach. So before I came off the medication for my heart, I was obviously very anxious before I did all these tips. I was very anxious, thinking, well, what happens when I come off my medication? Is it going to start up again? I'm going to have to go into hospital? I can't do that again, and things like that. Fortunately, I found a mindset coach just before I came off my medication. She helped me to train my mind to work for me instead of against me. She taught me how to develop a good mindset. She taught me how to trust in myself and believe in myself. She taught me how to challenge my thoughts, and that is ultimately what helped me. And that's why I decided to start to be a mindset coach, and obviously an anxiety coach, because I know how it feels to have anxiety. Because mindset is absolutely everything. Self-talk is absolutely everything, and dialoguing with your brain is absolutely everything. So if you are someone who wants to sort of let go of health anxiety, you need to start to really consciously make the effort to stop getting reassurance, reassure yourself, trust your body. Be mindful with your sensations in your body. Just sit with them and be okay that they're there. It's going to be unpleasant. It's not dangerous. Yes, it's going to be unpleasant, but it's not something that's going to hurt you or kill you. It's just something that's going to feel unpleasant and uncomfortable. And if you can just sit there mindful, be in the moment with it, that's what's going to reduce the health anxiety for you. So those are the tips that I can give you. And if it's something that is really, you really want help with it, definitely look up a therapist, because they can help you with the avoidance anxiety cycle too. So definitely look into that. So those are my tips. So start trusting yourself. Start to make a decision not to get reassurance all the time. A lot of people come to me and ask me, tell me a symptom that they have and say, oh, this is how I'm feeling, this is the symptom that I'm having right now, it's not this, is it? It's not COVID, is it? It's not this, whatever they're thinking that it is. you know, I'm not medically trained. I'm not medically trained, but the point is that they need to be asking themselves that question. So I always turn it around and say, what do you think? How do you feel? Start to ask yourselves the question, well, yeah, it's just a headache, or this is how I feel, but it's probably because I was doing that, or it's probably because I ate that, you know, things like that. Start to ask yourself the question back rather than going to someone else. If that's something that you do, constantly get reassurance from someone else. Start to ask yourself those questions. What do I think? What was I just doing previously? You know, things like that. So definitely try some of those tips. Let me know if you try some of them and tell me how they're working for you. Please comment if you're on replay, #replay. Please comment and ask me any questions that you have. I'm happy to help, or send me a DM. I'm happy to help and advise. I hope you have a good rest of the night. I'll see you soon. Bye.